charge 30% more in premiums to anyone who's allowed their insurance to lapse. The plan does keep the popular provision that lets people stay on their parents' plan until 26. There are no lifetime coverage caps, and insurers cannot deny coverage to people with pre-existing conditions.
Obamacare also made changes to Medicaid, the health program for low-income Americans. What does this bill change there?
Well, in some ways, that's where you see the biggest changes. First, the bill would allow the 31 states that expanded Medicaid to keep enrolling people until January 1st, 2020. These are people who earn above the poverty line, so an individual who makes about $16,000 a year. Lots of conservatives hate this part of the Affordable Care Act, but the expansion has led to 11 million more people on insurance. States that haven't expanded yet could also choose to do so, and the federal government will cover nearly all of the costs.
Now, Deanne, this is an early proposal. A lot of things can happen before it actually becomes law, but if Justin Ho, Katie Long, and Daniel Shin, our engineer this week is Charlton Thorpe, and I'm Mark Garrison with the Marketplace One Report. From 8 p.m., American Public Media.
You're listening to KCFR FM Denver, KCFC AM Boulder on HD2 at 90.1 FM. KCFC is also heard on translator K292GW 106.5 FM Boulder. Support comes from Edkin Johnson Real Estate Partners, a Denver-based firm specializing in the development, management, and leasing of commercial real estate across the Front Range for over 25 years. EdkinJohnson.com. Support comes from the University of Northern Colorado Graduate School, a doctoral granting research university with over 100 programs on campus, off campus, and online. More at unco.edu/.
And socialism didn't work. Then the onus of the argument is all of a sudden on our free market guys. Right? If you look at the cost of health care, if we wouldn't have had 20% cost increases over the years, and premium increases, etc., and you had a free market system, you got heart procedures here that are $150 grand, that in India are $15 grand.
But you agree that the federal government now still has a role in providing some baseline level of care. You concede that. Even though it's uncomfortable, you agree that there's a role.
Yeah. Milton Friedman, smart guy, Nobel Prize winner in economics, right? I taught economics for 20 years. You got to aim for the target. So this target, I want a complete insurance market. On the other hand, you can have a generous safety net system for folks across the board that handles everything, right? Food stamps, housing, health care, everything, right? But those things need to be lumped under the target so that families are taken care of.